Hi, everyone. My name is Lynn Sha. I work on healthcare issues for Senator Tom Carper from Delaware. Um, Delaware is typically regarded as a blue state. Our governor is a Democrat who actually just came from the House of Representatives, and our previous governor was a Democrat. My boss has been a representative of Delaware for decades at this point. And at the same time, I think what's less known about Delaware is that it is, even though it looks blue to the average person, it's actually a very collegial place and a very common sense place, and there's a lot of working together across party lines, and there is a lot of effort to work together in a practical way that is both fiscally responsible but also trying to make sure that the most vulnerable folks in our communities are not left behind. And I think that the encouraging thing that I take away from what Matt said and what his boss has said is that those are some things that are shared across both parties. Even so, I guess I say that to say, despite what you see in the news media and all of that, and I'm not saying that there's fake news or real news or anything like that, but there actually is a lot of areas of agreement, a lot of areas where people feel like we need to work together to get something done. And so I know that Matt and his boss feel that way, and so please don't be too discouraged by what you hear. There is a lot of efforts behind the scenes to sort of try and come together on some of these major priorities. And I think obesity is one of those. When I think back to when we started this process, and I'll just say this is an encouraging conference just to be had, because I think even 5 years ago, obesity was people understood, and I think you all probably understood obesity to be a major issue, but I don't think the AMA recognized it as a medical condition. There were so many sort of academic and research-oriented endeavors related to obesity, but it just wasn't sort of really on the radar screen for a lot of policymakers. And I think that is changing and changing rapidly. So as Matt was saying, the Treat and Reduce Obesity Act, that is now, it has over 150 co-sponsors in the House, maybe more than that, I forget the exact number. In the Senate, in the last count, we had more than 10 members. It's always been even, it's always been bipartisan. I think everyone agrees we have to do something on obesity. What's less clear is like how we pay for it. And I think there are a few areas, even beyond the Treat and Reduce Obesity Act that I would just point you to. I think that under the ACA, putting aside the politics of it, there is requirement under the ACA that folks would get access to preventive treatments without cost sharing. That includes counseling for weight reduction, particularly for those who may be overweight or obese. The take-up of that benefit under Medicare is extraordinarily low. I think it's probably extraordinarily low even in the insurance marketplaces. And I think we all collectively have to figure out how we get to a better place on those kinds of things, because I think everyone recognizes the diabetes prevention program and how successful that can be, and how we expand access to that program and other kinds of weight reduction counseling. That's something that I think we can always use more effort towards, and I think part of that is, frankly, I don't know that we've heard issues related to people being uncomfortable discussing weight. I think that goes both ways, both by the patients and the providers. I think there's issues related just to the understanding by healthcare providers and families all around these issues and ways to address them, even at the level of when you go to the grocery store and what to buy and how to prepare foods, and then how critical moving is during the day. We all, as you all know, we're increasingly sedentary. I think I'm just preaching to the choir, I know, but I think we could really use your help in figuring out how we really make a change in some of those trends, how we really sort of get more focus on how we get to a place in our communities where we are talking about how we get everyone to move more and eat more healthy. And then the other, more comprehensive and complicated drivers of obesity, the mental health related issues, the sociological issues, the environmental issues, all of those play a factor. And I think what's interesting about obesity is that it really, it comes through for us through the Finance Committee, because we cover Medicare and Medicaid, and also through the Health and Education Labor Pensions Committee. But really, it's almost like it could be addressed on some level in almost all the committees, right? The armed services folks care about this. the VA cares about this. The agricultural committees probably care about this. So there's really a role for everyone. So I encourage you to continue all the work you're doing and to be really creative and to bring us all your ideas, because I think this is an area where there's a lot of room for consensus and a lot of room to grow. And it's just encouraging to see everyone in the room together to try and figure out how we make progress here.